Hello, everyone, and welcome to Carolina Health Center's podcast, Access Matters, Beyond the Exam Room. Today, we are talking about recovery because September is Recovery Month. And so I have some wonderful people here that work at Carolina Health Centers with me, and we would like to go around and let them introduce themselves.
Hey, I'm Rebekah Higginbotham. I am the Greenwood County Opioid Response Coordinator with Carolina Health Centers.
I'm Molly Brunson. I'm a behavioral health consultant at the Uptown Family Practice and the Bethany Center.
And I'm Dr. Lance Braye, Director of Family Medicine at Carolina Health Centers and also one of our addiction medicine providers at Uptown Family Practice.
And I'm Rachel Manor, Director of Development, and I'm just here supporting these people all day, every day. So let's start off, and Molly, we'll start with you. So tell me a little bit about what brought you into this work.
I think it was really just having my own life touched by recovery and my family's life. And, you know, really looking at recovery as a family process and wanting to recognize that families go through so much during the process of addiction. And so initially when I wanted to go to school for counseling, it was really because of the families of people with addiction.
That's awesome. And I guess sometimes that's the piece that you don't think about is it's not just one person's journey. It's everyone that they love. It's their journey too. So thank you for saying that. Rebekah?
Well, I feel like this work kind of found me. I've had the benefit of working in several nonprofit realms, from working with the unhoused community to domestic violence survivors, veterans, and those with substance use disorder. And so, you know, when I was offered the position for opioid response coordinator, I felt like it was just a natural next step.
Awesome. And Dr. Braye?
Well, for me, I knew for the longest time I wanted to be a physician. Didn't really know much about the space of addiction medicine until I got to residency. I did residency at a community health center that also was serving a lot of folks that were struggling through addiction. And the interesting thing is, like, it's not like I never had any experience with addiction. You know, there's a history of alcoholism and things in my own family. But like a lot of things for me, when I just think of my journey as a doc, it's just stuff that you kind of just get so used to being like, there might not be much you can do about it until you learn, like, actually there is a lot you can do, and you should really help people get through it. And so that's what really got me into it. And then it's really become one of the more rewarding areas of practice for me, just really working with people, not just to get over the substance itself, but really help them rebuild their life and fill with so many other great things to give them that sense of support and love they need.
That's awesome. Let's talk about the connection between why does substance use disorder fall under behavioral health? Who wants to kind of jump on it?
I can jump in on that. I believe that with substance use disorders, a lot of the symptoms look behavioral. And so people do things that they might not normally do. It typically overlaps with other mental health issues. Nothing happens in a vacuum, you know. And so I think it's a natural thing for behavioral health to be a big part of the substance use recovery programs at CHC. The behavioral health part of it, you know, it can be very simple of, hey, there's just some really basic stuff that a person can do to change their lifestyle. And so sometimes it really is as simple as like, hey, maybe I don't need to go over here with this person anymore. And so it can be really, really simple.
Thank you. Anybody else want to speak to that?
Yeah, I think, you know, a lot of times folks think, well, you know, but aren't there medicines for it? But the abuse part is really a behavior, right? Like we think of something that's technically legal for adults that are of age, like alcohol. And so if all of us had a drink, that doesn't make it to be like, oh, you need to talk to somebody. But it's when that behavior gets to your, you know, using it over and above. And I think that's a lot of times, you know, some folks, they come think, well, you know, don't you have a pill for that or something I could take? Or, you know, just give me some Suboxone and I can get off of these opioids. And I always tell people, like, I can get you through your withdrawal. I can get it to where you might not be craving that anymore, but those behaviors that had you go to that substance in the first place are still going to be there. So it's probably, if we had to give percentages, probably a majority of it is behavioral.
And I would like to add that trauma-informed care is so important because oftentimes, not all the time, trauma comes into play with substance use. So in a sense, it's self-medication. And I've seen many success stories. I'm one of them where I received the counseling that I needed. And just getting to the root of what was going on with my addiction. It was a life changer. And so there is no shame in that.
Absolutely. I think when we work around these things, it's easy to use phrases like trauma-informed care and know what you're talking about. But let's explain that a little bit for maybe listeners or viewers who don't know what trauma-informed care looks like or kind of define that. So, yeah.
Would you like to take that?
Sure. So trauma-informed is really about, there's no surprises here. When a person comes in for their care, whether it's with Dr. Braye or myself, or they call Rebekah, that person wants to be treated, number one, with dignity and respect. The main thing is that they feel safe when they come to see us. And so I like to practice from the standpoint of, hey, I'm not surprising you with things when you come in the door. I'm going to explain things as we're doing them. I'm not going to be throwing therapeutic interventions at you without explaining, hey, this is why we're doing this, or this is like where I'm going with this. And really thinking about trauma from a substance use disorder perspective. So many people have trauma prior to that, and then there's trauma during the use, and then there's the trauma of actually trying to get sober. And so it's a really big part of that process. At least for me as a clinician, it's a major focal point of working with substance use.
Okay. Anybody else want to speak to trauma-informed care before we
I think Molly did a great job.
Yeah, I do. I 100% agree. All right. So for Greenwood County and surrounding areas, what addiction challenges do you see most, or do you see trending? What are some of the things that you deal with most, or that you want to speak to? Maybe it's not most, but
Sure. One thing that I'm seeing that's trending is so many substances being laced with fentanyl. It's no surprise, and it's nothing new to hear that a particular substance has been laced. But people are passing away at just unreal levels, just whether it be marijuana, things that most people, they don't even think about, something like that, until they're waking up in the ER. Another trend that's kind of trickling through into Greenwood would be xylazine. And that is actually a veterinary tranquilizer. And so that is something that cartels are actually putting into fentanyl. It's cheaper than fentanyl. And it makes the high from fentanyl much stronger.
okay.
And so one unfortunate part of that is that naloxone, which is Narcan, will not touch that if there is an overdose. It will not reverse the overdose, which is incredibly scary.
Right.
Right now, as far as having a drug test, it's not something that's listed to be checked. And so right now we look at symptoms. First responders, they'll look at symptoms, which would be, low heart rate. You could have sores. Xylazine actually causes horrible sores on the body that just become infected. It's really terrible.
But this has been found in Greenwood.
Right, it has.
We're not immune.
It has.
And that's kind of the,
Yes. And so just the testing end of things for that has not made its way here yet. Charleston County is actually leading the way in providing xylazine test strips.
Okay.
Which is very exciting, and they've seen a huge uptick in that there in Charleston County.
Yeah.
And it's not going to just be limited. It's all over South Carolina.
Right.
It's a problem across the board in the U.S.
But I know that was one of those things that I think I heard about, I don't know, probably a couple of years ago.
Yes.
And because you don't hear about it all the time, or it's just easy, we're a small town, or we live in small towns, it's easy to kind of think, well, oh, that's probably in bigger cities, right? Well, people go to bigger cities and then they come back to their smaller towns, right? And so to hear that, and to hear that naloxone does not touch that, is terrifying. Because then what does someone do?
And many individuals are not seeking that drug.
Sure,
they're seeking, and it's just in it, and they don't even realize.
Right.
Which is why xylazine test strips, I think, would be incredibly helpful with that for folks who might want to test. And is this in here? That would be available to them. Sure. And like I said, Charleston County is leading the way for that. Yeah. I'd love to see that here in Greenwood County.
Maybe our pharmacies can get their hands on some, because you can get fentanyl test strips for free from our pharmacies, and we hand them out. We try to hand them out everywhere we go. You can also get free naloxone from our pharmacies, just to give that little plug in there. What other challenges are we seeing in Greenwood?
I think you mentioned one of them yourself when you talked about people thinking like, oh, that only happens in a big city and doesn't happen here. I think just with the area we serve being so rural, you kind of run into a couple different things with that. Like with that isolation, one, making it a little bit easier to, struggle through your addiction, and make that recovery a little more complicated, because in some places, and maybe not necessarily in a city like Greenwood, but you think of between Greenwood, Lawrence, Edgefield, Abbeville, McCormick, Newberry, Saluda County, is like just how isolating it can be if you're just out there in the country and you're struggling with that, right? But then also in smaller towns, people tend to think, oh, that's not a problem here. That's like an Atlanta problem or a Charleston problem. It's like, nah, it's here. And so I think sometimes it's with that challenge, as we also, in the work that we do, really, because we're not just helping the folks that are in recovery, but also we want to kind of empower the community a bit to be a better support for them, to give them the resources so they can, say, hey, you should talk to Rebekah, or you should go over to Carolina Health Centers. They have doctors that can help you through this, right? And so I think that by itself makes it a bit difficult, because then it kind of becomes like this almost like a silent crisis in some ways, because it's a problem, it's happening. But one thing that surprises me many times is how many people aren't aware that it's happening.
Or just that I know this isn't just a Southern thing, but I was born and raised in the South. And so it's that thing of like, not my family, not my, right? There's a denial, an avoidance, not my friend, not my friend's daughter or a son, or not my own daughter or son, right? And so, or there's a shame that for people who are experiencing addiction, that they don't go seek help because of the fear of being outed and then everybody feeling disappointed. So how do you connect with those people who are hesitant to seek help? How do you identify them? And then what are the next steps to that?
Absolutely. So the wonderful thing about my intake line, anyone in Greenwood County, you do not have to be a patient at Carolina Health Centers. Anyone in the county can reach out to my intake line. They will reach me directly. It is a secure line. They can feel safe that their information isn't going to be out there, and they can simply talk to me about, this is what I'm struggling with. Can you help me navigate through this process? What resources are available? And I can help guide them through that process. But at the same time, trust is a huge part of this. I want folks to know that I am a safe space. I have lived experience. And every person's, road to recovery is different. But, I just want people to feel like they can call on me and that I'm a dependable resource, that I follow through, and that, hopefully they'll spread the words and tell others about the resource as well.
Sure.
And I was going to say, too, one of the things that I love about doing behavioral health care in the primary care setting is that when people come here to see us, nobody knows why you're here. So, like, if you are worried about, I don't want to go to a treatment center, I don't want to go somewhere where everybody knows I'm there to get, Suboxone or methadone or something like that, or even just counseling, you could be here to see Dr. Braye for a cold. Nobody has to know that you're here for something else. And the other thing is that sometimes just being okay with recovering out loud. I'm a person in long-term recovery. I don't mind sharing that with people because sometimes people don't know that recovery is possible. People think this is all it can ever be. This is what I do. And, it's a hopeless situation. And so having people that are willing to share out loud, like Rebekah, the fact that we're able to offer peer support at Carolina Health Center now. We have Kristen McCrary. She is a certified peer support specialist, available to work with folks in the community and with our patients. And so I think we're really trying to do our best to cover all the bases with that.
I love that. Anything you want to add to that?
No, I agree with both these ladies. A lot of it is when you're right there with the person, right? Like practicing that trauma-informed care and kind of like, I'll say, normalizing it a bit. Like I've had folks sometimes where, we'd be talking about like a cold or something and they want to bring up that they're struggling with an addiction, but then it kind of gets into hushed tones and it's like, well, I do have this other thing. You know what I mean? I'm just like, what's going on? Like, right. Oh yeah, like, and just normalizing it for them to be like, oh, okay, like, and
it's
so
still just a part of the conversation.
Yeah. And so for me as a medical provider, like if you're disclosing that you're struggling with an addiction, even if, if it's something that people would consider like a hard drug, like crack or something like that, I'm going to give that the same attention and level of alarm that I would if you're telling me that, you'd like to talk about losing weight or something like that, right? To not feed into that thing of like, oh my goodness, like this is what we're talking about. I was like, no, I'm a family doc. We do that too. So let's talk about it.
Yeah.
And so and then for me, also thinking of it, I'm not dealing with like any type of recovery from a substance, but like I definitely consider myself an ally to it. And so one kind of like little shocking statement I like to use for people, I think Molly's probably heard me say this before, is like, we're all addicted to something. Right? Some of us just go to jail if we get caught with a thing we're addicted to. Some of us, nobody will think it's a problem with what we're addicted to until they see all these empty bottles all over the place. And the rest of us are just lucky that it happens to be like cheeseburgers or, your favorite thing, right?
The internet or video games. Yeah, it's something.
And it's not to belittle, it's not to belittle substance abuse or recovery, but to get people to understand like that behavioral piece of it. Like just like, telling myself, I have a stressful day here, and some of my patients have probably seen my truck sitting at the cookout afterwards because I'm like, forget this. I need a milkshake, right? But that's my thing that I struggle with, right? Sure. Whereas what if on the flip side, if it was after a long day at work, y'all see my truck at the liquor store. And in both those cases, that's a human really dealing with a lot of stress. And yes, they should be able just to go to the gym to burn that stress off, right? But they're like, I need something, right? But there's a difference, and so for me, it's like when we think of like how we put this like level of alarm because like, you're at the liquor store versus you're getting way too many milkshakes and cheeseburgers for yourself. But in both cases, you could argue like, this is kind of a destructive behavior that I'm doing, right? And it gets back to that behavioral health piece. And again, it's not to belittle, but I feel like one thing that just drives me crazy is how people are like, but they're addicted. And it's like, but they're human. Sure. And we're going to help the human through their things, just like we help all the other humans through their things.
Oh, I love that human piece. What keeps you motivated in what you do? Because sometimes when I sit back, obviously like I'm like a behind the scenes, I don't have like a patient facing, like consistently patient facing, position here. And even just some of the stories that I can hear that, in passing or for whatever reason, they come across my purview, they're heavy. And that's hard. That can be hard to carry. And you go home thinking about it. And you wake up the next day and you're still thinking about it. And how I know you're also trained to do this, but how do you manage that for yourself and then like stay motivated when you don't always see the successes that you want for everyone? I know that's like loaded question, but hit me with your answer. Give me the easy answer.
I think for me, I try not to look at it as a success rate.
Okay.
Because the very fact that they reach out is a success.
Love that. Okay.
And so the seed is planted. And, whether or not it's their third time, 20th time calling.
Keep calling.
Don't give up. I will meet you where you're at. We will meet you where you're at.
20 bajillion times.
Yes, absolutely. And the recovery community in Greenwood County is phenomenal. We have an amazing recovery community. Carolina Health Centers is amazing, and so I'm excited to be a part of such a community that cares, that truly cares.
Sure. So. What makes the recovery community and all of the moving parts, what makes it amazing? Like, when you say that, like, why?
Right. So I feel like a lot of it is unity.
Okay.
We have many churches who have programs, whether it's, and we have AA, we have NA, we have Celebrate Recovery. There are many that folks can attend. We have faith-based recovery homes. We have non-faith-based recovery homes. We run the gamut, of those kinds of things. And I feel like as a community, there is a lot to be offered, and a lot of what is offered is from those with lived experience. And so everyone comes together. We don't all have to believe the same way. We don't all have to have the same recovery journey. My recovery journey is not the same as someone else's.
Sure.
And so at the end of the day, just to have that community and know that you have the support, it's wonderful. I think it's amazing. So,
Good, Molly.
I would say the community in Greenwood, it's been here for a long time.
Sure.
The recovery community has been stable in Greenwood for a long time. And, I always like to give people this example of trying to pick a recovery program. Okay, you are drowning in a river. And if I throw you a raft or a life jacket, are you going to throw it back because there's something about me that you don't like?
Sure.
Nothing.
That raft was blue. I don't want that one.
Nothing's going to be perfect. And so there are multiple pathways to recovery. And so part of our job is to help you figure out, what does your path look like? Because what works for me might not work for you. However, there are some pretty consistent principles in recovery across the board that can help you out. And so I agree. I think Greenwood has a great supportive community. I think we're getting a lot more access to, actual care as well. And so I'm excited for that.
All right. So the community and all of the backing and kind of that network is what kind of keeps y'all motivated.
Yes.
That's okay.
Yes.
You.
Yeah.
You, Braye.
Me. I think what keeps me motivated, on the one hand, is definitely that community aspect to it. But even like within just our organization by itself, right? Like knowing that if someone needs something, I've got Molly and the other behavioral health providers. If it's something that requires a little bit more what I call special ops outside the office stuff, I've got Rebekah.
Sure,
and now we have peer support and all that. But I think another big thing that keeps me motivated, because we're not going to sugarcoat it. It is hard, right? And there's folks that we're going to try to help, and it may not work out. But then what keeps me motivated is knowing that, like Molly said earlier, that recovery is possible, that I have literally seen people change their entire life, like to the point, like I still don't believe it. But it happened because recovery is possible. And so it's like, and that's really the most motivating thing about it. Like I said, where it's become one of the more rewarding parts of my practice. Cause like I have like I tell people sometimes, like, my favorite patients to work with, if I had to pick, would probably be my patients in recovery, because those are some wise people. Like, just because they've been to the pit and they're making it out and they're fighting, and I've actually become a better person just from taking care of them.
Oh. That one got me. That one got me for a second. Well, no, because there is something to be said about that lived experience, and even in connecting, because both of you shared that you are in recovery, or that's how I refer to it, right? I always want to make sure I'm saying the right thing, that you were in active recovery, long-term active recovery. But is that a point? That's a point of connection. Do you often use that as a way to connect with people, or how do you discern?
I think it depends for me if it's appropriate or not, know, and sometimes it is and sometimes it isn't. You don't
want it to feel like, oh my gosh, me too.
Right.
No, you're not saying that.
Typically as
same girl,
as a counselor, it's a little bit different because there's, kind of different boundaries, but I'm very proud of my recovery and I'm very happy to share that with people. And part of what keeps me motivated, I believe, is the motivation for my own recovery. Because if you try to do this kind of work and you don't have your own house in order, it can be a really big hot mess. Oof. And people have a tendency to backslide in some cases. And so staying on top of it for yourself is so important. And, try to practice what I preach. I try not to suggest things for people that, maybe I wouldn't be willing to do myself. Mm-hmm. But yeah, I think self-disclosure, it's a useful thing sometimes. And then sometimes, that might not be what that person needs at that moment. So if it doesn't benefit the patient in some way,
Sure.
But usually I also very much enjoy working with our patients in recovery. And the ones that are not in recovery yet, I think it is probably one of my favorite parts of my job. So
I love that. What is something that you guys wish, not just Greenwood, but Greenwood and any community, let's just say any community, what is something that you wish they would change their views on in regards to addiction?
One thing among many, I would say, and this has been recently, is I wish that individuals who are employed and are struggling with substance use would feel free to go to leadership and take advantage of an employee assistance program. Many they don't know, and the stigma is there where, okay, you're going into work day in and day out, you're trying to keep it together for fear of being fired. But how beautiful is it that you could go to leadership and say, hey, I'm struggling and I need some help and I need some resources. And for that to be met with, well, here's the number. We can help you and not have to worry about job security. And thankfully, we have Cornerstone here in Greenwood, and they're absolutely amazing. So, employees aren't calling just, 1-800 number. They are actually
they're here
speaking to warm voices who are eager to help. And so, that's something that I think more people realized. And I think it would affect turnover. I think that it would affect families. Many people are going to work. They have families. I mean, this is broad in the areas that can have a positive influence if individuals are very familiar with the services that they can have.
So do you think, it's that hesitancy of security that is why people don't go toward, okay.
Yes.
Okay. And see, I have so many thoughts running through my head because your employer, if there is an EAP program at the organization, from our point of view, granted we're a healthcare organization, they want you. They're like, no, like this is a thing. If you need it, and everything's like confidential. And maybe that's another piece that people don't understand. They think everybody that they work with is going to know why they went, and they're not. because they can't. They're not supposed to know everybody. But okay. So I won't go down that rabbit hole. What else?
I agree with like the family part of recovery where, you might have a loved one that is really struggling and, by proxy, you're struggling with that person. And so realizing that there is help and support for, family members of people with substance use disorder, that we're here in the recovery community to support them as well. Also with mental health services, because, addiction really is a family disease. And so everybody suffers, whether it's grandparents taking care of their children's children or,
Right.
All of these things that can get really messy for people where they're stepping in trying to help, but maybe like they don't really know, like, am I helping or am I hurting and things like that. And so just knowing that, hey, we're here to support the whole family, not just the person.
Or also like devaluing their own experience because they don't feel like the person that is in their family that is dealing with addiction, they feel like directly, they feel like their problems are smaller. And so they don't want to, they feel like they've got to keep it all together. So that person can have their moment and then they can work that out. And in the end, it's like, no, we can support everybody at the same time. And that's what's really, really awesome about having that integrated, that behavioral health integrated into primary care. Where, like you said, nobody knows why you're here. You might be here for a cold. You might be here for your blood pressure. You might be here for a counseling appointment, for MAT. Like it could be a number of things, but whatever the need, like we're here to meet it. What about you, Dr. Braye? If I need to repeat the question, I can.
Could you?
I was hoping you would say no.
You want to.
I did. I asked. So it was, if there was something that you could tell people to kind of, what's the thing that you would want the community to know about? What do you wish people knew about addiction?
Yeah, I would just echo what I was saying earlier. I wish they knew that it could happen to anybody.
Sure.
Right? That another shocking thing I use to get the crowd going is being like, no one ever says at 10 years old on career day, I want to struggle with drugs when I grow up, right?
Sure.
And so nobody dealing with addiction asked for it. It was not ever part of a plan. Like they just ended up with a certain set of circumstances in life that the thing that they were self-medicating with, because that's really what people are doing, is this. And a lot of times, when it comes into, discussions that me and Molly and other behavioral health providers have had over shared patients and things, like sometimes that big question mark is like, but what is this person treating in their life? Because the goal wasn't just to get high or anything like that. It's like they're medicating or try to avoid something. And I think when you look at it like that, that allows really the whole community to be more trauma informed and realize that addiction isn't something that only those type of people have. But again, it's something that people have. And I think if we started to take a look to that, you would probably see even more support in the community, even for, a place with so much support like Greenwood, right? Like across all different groups. Because I, just thinking of my own journey and being a provider for it, I've had times like just knowing that, my family was heavily impacted because of that community issue of abuse, thinking of like, my father growing up in Brooklyn during the crack epidemic. Like he's got some really rough stories and he did not use. It was just from being in the neighborhood where that type of stuff was going down. And I think as it's become more popular over the years, right, there's that sense of like, oh, now that it's not just like an us issue, now everyone cares, right? And it's just, and I think a lot of times just kind of looking at that, and yes, there's a weird past as a country, there's a weird past as just a state or even a community to where people, no matter what walk of life they're from, what color their skin is, they might feel weird about talking about recovery. But we just really need to remember that this could happen to anyone, and we should really challenge ourselves not to forget this. We can't forget it, right? But also to acknowledge the truth through the whole situation, which is people that are in poverty, there's probably a bit of a higher likelihood, but also that people that are not in poverty can struggle with things, because it's not like a rich person, poor person thing. It's not a black, white thing. It's not a Christian, not a Christian thing. It's a human thing. And the more we realize that, oh, not my kids. Yeah, it could be your kids. not my cousin, yeah, could be your cousin. Because otherwise we're just sitting there shocked when we've lost someone to an overdose or from some other poor outcome. So that I think that's the biggest thing we could do is just realize that this is a problem. It's here and we need to do something about it as a community, because when it goes bad, it does affect the community, right? Like whether it's crime related to it, like what my dad went through growing up, or whether it's, you know, a drunk driver, you know, hurting somebody, or even if it's just someone overdosing, that's a life that's gone and we can never get back. And so we just really have to remember that this is really a fight for all of us.
And all the people that love the people we love. Like it really is. It's that human thing. So how, and I know the answer is always we have to talk about it more, but how do we talk about it more to reduce the stigma? Right? Because, and I'm going to just hit this head on. We just recently did a mailer for the Greenwood opioid action. What's the
promotional?
It's the campaign for it. So it's Next Best Steps is the campaign title, and it is for Rebekah's services as the Greenwood County Opioid Response Coordinator, and it's literally random and covers random people all over Greenwood County. And she's been fielding phone calls from people thinking they were targeted specifically about those services. And they're not that they're like super angry calling, but they're like, hey, there's an immediate thing of like, whoa, that's not me. I don't need this service. And it was like I said, it was a mailer. It was the same way your politicians send stuff out. It's the same way a lot of people send things out. But there's that knee-jerk reaction of, oh, well, I need everybody to know this is not me. And there's a hands-off like moment of that. Like, okay, well, and we don't want you to throw the mailers away, okay? If they do not apply to you, great. Put them somewhere within the community where someone else might see them, and that they could, be seen, and maybe they need that information, or they have a loved one who needs that information. But it's next, let's do a little plug. Rebekah's number is on there, but also you can find Rebekah's information at nextbeststeps.org. And so that's one way we're trying to battle the stigma, but obviously we immediately saw people's responses to it, right? Immediately. And because any other mailer I've ever gotten, I don't call the number and say, this does not apply to me. Right? I don't. Maybe some people do. But so how do we talk about it in the right way? Please.
You really hit the nail on the head. It's like talk about it in the right way. And you're doing an amazing job with this podcast of using recovery informed language, talking about addiction and people with addiction issues, having a substance use disorder, trying to use appropriate language around things. It's really important to do that because that does help reduce the way that people talk about things just conversationally.
Sure.
And that to me is a really good place to start, and to make sure that for me, myself, like it's very easy for me to throw out, some recovery slang kind of things that maybe necessarily other folks wouldn't understand. And so making sure that I'm using appropriate language, to be respectful of people and those types of things is really important.
Okay. Anything else? How do we talk about it in the right way?
I mean, I would say you keep talking about it, right? Like,
sure, okay.
Now, I'm not in charge of these mailers, but if it was up to me, send them again.
We're going to send some more. Where's the 20,000 more?
Because it's just like it shows like just that response shows that we have more work to do. Like you would, like you would only get that because clearly, and actually I'm not even gonna try to like think of other people's thoughts, but it just makes me think of like, there are no trees in my yard in my little neighborhood, but yet I get mailers about taking the trees down, and I'm just like,
sure,
no trees to be had here, good sir.
Sure.
But I don't think like I'm gonna call this tree service like you better stop sending this mail, right? And so
I don't have trees, sir.
And so even then,
and that's not to say anything negative, because Rebekah, the response once she explains to people what it is and that it is not specifically about them, I think they were very warm and welcoming to it.
Absolutely.
So it's not saying anything negative about someone calling and learning about it. Honestly, I'm glad. You know what? Let me be honest. I'm glad they called because now they know more,
Yeah.
and they're like, oh. And so if they know someone who knows someone who needs that service, now there's more information they have. So I'm going to say that, you know what? I'm glad they called.
And send them again. So
Let's
call some
light
more.
everybody up a little
Yeah.
bit. Let's offend everybody enough. So that they'll call the number. But no, to that, nobody had like a negative response, but it was very indicative of the knee-jerk reaction a lot of us have of like, whoa, I need you to know this isn't me. And you're like, well, it's addressed to you, but maybe pass the information along. Like just, you know what I mean? It's that kind of thing.
And this could just be the inquisitive doctor in me, right? But it's like, but why was it such a knee jerk, right? As something just for us to check ourselves about, like, like just think of other things just, in the past 30, 40 years that we've progressed as a society and talking about, there's a time where a lot of things, if you said that like in 1992, people are like, whoa, that's weird. And now we say like, oh, it's fine, And so I think it just shows that we have to, we just got to keep talking about it so it becomes more normal. And then, and then folks can see that that's what it's about. And, but then also you kind of, this is like I tell my students here at the health center, like this is some activist stuff we do, right? And so like there's also a level to that. Like there's also a bit of activism to it of like, yeah, we're probably gonna slightly offend.
You're gonna step on somebody's toes.
But it needs to be done to challenge thoughts and ideas that are not conducive, right? And any type of good social movement. And I think that's the other thing that I really enjoy about the work with addictions. It's like it's also like a social movement in itself to say like, yes, on the one hand, this is a diagnosable thing that, I can prescribe Suboxone or whatever, and, behavioral health can work with them on the behaviors and the mental health and things that feed into it. But also we're fighting for human dignity on a lot of people. And I think, we've all probably been in rooms where someone said something, not realizing that we are part of this work or that we might be in recovery ourselves, where you're like, that was kind of messed up, right?
Sure.
But the fact that they think that is normal is not okay. Just like we look at movies or videos from like years ago when everyone's got a cigarette in their mouth, and that's weird now.
But it's coming back.
Yeah. Well,
it's coming. I've noticed it on those. I've noticed it. It's coming back. But anyways, yes.
We just have to challenge it and make it slightly uncomfortable. It became uncomfortable at one point, right? To just like whip out your cigarette on a plane, and now you don't.
And apparently, I would like. I off the top of my head, I can't remember how old you are, but I was alive during a time where you could smoke on planes, and I don't think I realized that until like recently. And also, I remember when I first moved to Greenwood, they had those. I went into McDonald's, and they had the little tin ashtrays on the table, and I think back to that. That's so foreign now. Right? Because we're not actually that far removed from it, but it feels like we are because we've taken that smoking in public thing out. But I remember that, and that feels so crazy that people would just light up a cigarette.
Yeah. Like
in a McDonald's. That's wild. So anyways, to that, there are things that can be normalized is right. And so you don't have to, we can do this. One mailer at a time.
Yeah, right. Because
send more mailers.
You mentioned people, worried about losing their job because they're dealing with like a substance use situation, and it's like, so we got work to do because like one day it'll be weird, and we hope there'll be someone saying, like, "Man, I remember back when I first started working here, someone just said they had a problem with pills. They were fired, even though they were in the EAP or something like that."
Sure.
We're trying to get to and so that's the thing. Like, so yeah, it's Yeah, I would say send some more.
Shifts can happen. Yeah. Sure. We will. Shifts can happen, and we will. Yeah, we're gonna send more mailers. I gotta look at that budget. No. So, is there anything else that any of y'all would like to say about your experiences or other people's experiences? Is there anything you would like to share, or anything you would like to ask one another? Any points you would like to bring up with one another? I see you all thinking.
Well, I mean,
go ahead.
I just wanted to like publicly acknowledge how much I appreciate these ladies across from us here, because really, like, absolutely. It's y'all are the secret sauce of what we do. Because I've only got people for 15, 20 minutes at a time, but when it comes to everything that I can't really do much about outside the office. That's where y'all come in. So really appreciate y'all and appreciate us having such a comprehensive team for this.
And thank you for everything you do.
I agree. I'm just appreciative of our team, and knowing like if I'm having a really hard day, I can call Rebekah. I can be like, hey, you know what? This one was really tough today. Or I'm, maybe I'm just really tired or things like that. And, just really getting to sit back and watch people do what they do, and be really proud of the organization.
Oh, I love that. Yeah, go ahead.
I was going to add to that. I would say that I feel like there is not one person in our organization that if I was struggling with something or like Molly was saying, a bad day or just an emotional case that, you've been working with, but I feel like I could go to anyone in this organization and they would be there. And everyone's there for one another. That's just the way it is here. And it's a beautiful thing. I love Carolina Health Centers. I'll just say that. Yeah.
Me too. No, I love that. So, thank you, all three of you, for being here and taking the time to do this today and to just kind of talk about it, keep having the conversation, and just hit some points that you want people to know about. Rebekah, your phone number, hit us with your phone. We'll put it in we'll put it across the screen and all the things, but hit us with your phone number. Yeah, and the mailers.
Perfect. Okay, my number is 864-929-7528. If you call and I'm not able to answer, please leave a voicemail. I will return your call. And so I hope that folks will feel comfortable to get in touch with me. There's a whole community here and within Greenwood County that is looking forward to helping.
Absolutely. And Rebekah will help connect to resources. Are there any other resources or hotlines or anything that Molly or Dr. Braye that you wish anybody knew about?
Most people know about the 988 suicide text line.
Absolutely.
Where if people are having, suicidal thoughts or, is really struggling with that you can text or call the 988 line. I'd like to throw that out there just because so often that is a part of substance use and people really struggle with that. So that's something that's out there too.
Okay, wonderful. Anything? Or just Carolina Health Centers.
Carolina Health Centers.
Just call us.
No, but also if anyone out there, they're already a patient, you don't need to wait for a visit with me or any of the other folks that do addiction more often than not. In family medicine, I tell all my people, we're going to be everything our community needs within reason, because you don't want me doing your back surgery. But so even if you're like, oh, well, I go there, but, I don't know if my doctor does, is bring it up. Because we work as a team, not just between the different departments, but even within family medicine itself. And so if you or a loved one are dealing with substance abuse and you're already here, just talk to whoever your provider is and we'll get you in the right spot. And then if you're not here yet, but you could use a PCP, you know where to find us.
That means primary care provider.
Sorry, I was using my lingo.
No, it's fine. We all do it. We live in the world, and so we do it. So it's fine.
But so if you also just need to get into the office, then come find us.
I love that. All right. Well, you guys heard it. If you need any help, thank you guys again for being here, Rebekah, Molly, Dr. Braye. If you or a loved one needs help and you don't know where to start, a solid place to start is to call Rebekah or visit nextbeststeps.org, and you will find her contact information, and she will figure out who to get you in contact with. And we would love to be a part of helping you figure out your next best steps. And so please subscribe, our Facebook pages. We have more podcasts coming in the future for different topics related to all different things, services, community resources. We have plans. All right. So thank you very much. And thank you guys.
Thank you.